Okay, let's quickly move to the congestive heart failure CHF. Let's see what is congestive heart failure. Congestive heart failure means the cardiac output insufficient to meet the demands of tissue perfusion. Heart failure may occur due to the systolic dysfunction or maybe diastolic dysfunctions. Let's see the systolic dysfunction first. So, systolic dysfunction means the ventricles are dilated, unable to develop sufficient wall tension to eject adequate quantity of blood. It may be occurred due to ischemic heart disease, or maybe dilated cardiomyopathy, or maybe cardiomyopathy, or valvular incompetence, and finally the tachyarrhythmiasis. Due to the particular conditions, you may find systolic dysfunctions. Due to the systolic dysfunctions, you may occur congestive heart failure. So diastolic dysfunction means the ventricular wall is thickened, unable to relax properly during contraction. So ventricle filling is impaired due to low output. It may occur due to this hypertrophic cardiomyopathy, or maybe the congenital heart disease, or aviations, or aortic stenosis, and sustained hypertension. So aviations means the abnormal connection between the arteries and veins in the heart. Aortic stenosis means the blood vessels become narrow in the heart. Blood vessels become narrow. Due to that, it will reduce the blood flow. It may occur to the cardiac output become reduced. So these are the main two dysfunctions you may occur heart failure: systolic and diastolic dysfunction. Let's see the classification of congestive heart failure. You may find two types of categories. One is relief of congestive or low output symptoms and restore of cardiac performance. These particular drugs will reduce the symptoms of congestive heart failure, and it will restore or make better performance of the heart. And another category is arrest or reversal of disease progression and prolongation of survival. These are the particular drugs will make the prolongation of our life, and it will decrease the progression, the further disease progression. So let's check out the classification of congestive heart failures, the particular drugs: beta blockers, vasodilators, diuretic, inotropic drugs, and here aldosterone antagonists. Okay, so before moving to the treatment of the congestive heart failure, let's see the cycle of congestive heart failure. So due to the myocardial adequacy, you may reduce the cardiac output. Due to the reduction of cardiac output, it may find some compensatory mechanisms like Roy's activation and the stimulation of sympathetic nervous system. Due to these compensatory mechanisms, you may find increased systemic vascular resistance. Due to this increased systemic vascular resistance, it will increase the impedance to ventricular outflow. This leads to the reduced cardiac output. It will reduce the cardiac output. So this is the cycle. Due to this compensatory mechanism, volume expansion is increased in the heart. Due to this volume expansion, initially it will increase the stroke volume, and later it will dilate the ventricles. That leads to the reduction of cardiac output. So this cycle will go until the congestive heart failure, till the heart fail. And another mechanism, due to this stimulation of sympathetic nervous system and RAS activation, it will lead to the ventricular remodeling. So ventricular remodeling means a change in the size, shape, structure and function of heart. It leads to the injury to the heart muscles. That leads to and this increased impedance to ventricular outflow leads to ventricular remodeling, and ventricular dilation also leads to ventricular remodeling, that leads to myocardial inadequacy, that leads to reduced cardiac output. And another mechanism of reducing the cardiac output is in the RAS activation process, it will release the aldosterone. Due to this aldosterone production, it may find the ventricular remodeling, and it leads to the volume expansion also. So this is a cycle of congestive heart failure. This cycle will go consecutively to reduce the cardiac output. Finally, the congestive heart failure may find. Okay, let's see the treatment. Myocardial inadequacy, the digitalis, the particular drug will decrease the myocardial inadequacy, so that it will reduce the cardiac output. It may increase the function of the heart. Then it will the vasodilators will reduce the ventricular dilation, so that it will reduce the ventricular remodeling, reduce the cardiac output. So it will reduce the symptoms of the particular congestive heart failure, and it may decrease the vascular resistance. And finally, it will perform, or it will increase the function of the heart normally. Then the diuretics will decrease the volume expansion in the heart, so that diuretics, it will remove the excess volume which is present in the heart. It will reduces that particular volume, excess volume, so that the heart may function properly. Then the beta blockers will reduce the function of sympathetic nervous systems. Okay. Then the RAS system, the AC inhibitor drugs will decrease the activation of RAS, so that no more ventricular remodeling will happen, so no more myocardial inadequacy, so no more further reduction of cardiac output. It will reduce. These are the particular drugs. We will first reduce the symptoms which occurred in the congestive heart failure, and finally it will also make a performance or performance of heart normally. So aldosterone antagonists like spironolactone, it will reduce the function of aldosterone, which is making the ventricular remodeling. So these are the particular drugs. And one more, this arterial or dilators will decrease the ventricular outflow, so that no more cardiac output reduction. So all the particular drugs will reduce the symptoms of congestive heart failure and make the function of heart properly. So this is a congestive heart failure cycle and the treatment. So if you want pathophysiology of congestive heart failure, check the description of this video. I will forward the link of a particular pathophysiology of the congestive heart failure.